Welcome to End of Life University on YouTube. Today, I'm sharing with you a conversation with Emma Payne, who's the founder and CEO of Help Texts. And we're talking all about her company and how it provides support to grievers, but also caregivers and healthcare providers via text message. And this is a service you should really know about. So I hope you'll enjoy our conversation. Make sure you subscribe using the button down below, and also subscribe and leave a rating and review for the podcast wherever you happen to listen. And go to eoluniversity.com/support if you're willing and able to make a small contribution that will help keep this show and the podcast on the air. And thanks in advance if you choose to do that. So here we go with our interview. Today, I'm very excited to welcome back my guest, Emma Payne. She was here, we aren't sure how many years ago, but a few years in the past, and I'm so excited to do an update with her. Emma is a seasoned technology entrepreneur, an MIT graduate, and the founder and CEO of Help Texts, which provides private grief, caregiver, or mental health support via personalized text messages. And we're going to talk all about that. Help Text combines Emma's passion for mobile technology and engagement with her deep commitment to making sure everyone gets the support they need when life gets hard. Founded in 2018, Help Text was the first in the world to publish data on grief-informed texting and is now delivering support in 44 countries and 24 languages. And you can find out more about it at the website helptext.com. So Emma, welcome and thanks for joining me today.
Thanks for having me. Great to be back.
Yes, I was excited to talk to you. And, that very statistic, delivering support in
I
44 countries
know.
and 24 languages, like that's one of the reasons I
I
needed to talk
know.
to you again because things have grown and changed so much since our
Yeah,
first
we're all in
conversation.
all 50 states now. About a year or maybe a year and a half ago, somebody in South Dakota signed up and we're like, woo, it's all 50
Your
states.
last, the 50th one. Wow.
Um, but I do for sure spend time reflecting these days about how, I mean, this was an idea I mapped out on an airplane ride, literally. So when I hear this, even as I heard you say back to me 44 countries and 50 states, it feels pretty amazing.
Yeah.
Incredible.
Yeah. We talked about how you got inspired to create it on our previous episode, but I have so many new listeners now. I'd love if you could just tell us that story a little bit about the airplane ride and what was
Yeah,
happening.
sure. Yeah, I was flying back. My friend died in 2015, and it was my first time being bedside with someone as they died, and he had asked me to deliver a eulogy at his funeral, which of course I agreed to do. But it was a tough ask because he was the best friend and also second cousin of my husband who had died a decade prior by suicide. So essentially, what I had agreed to do was fly across the country and stand and speak in front of a lot of people, many of whom I had not heard from in the decade since Barry died. And so, really, from the moment I sat in my pew, all through the pub night and everything, I heard some version of, I'm so sorry I didn't reach out back then. I didn't know what to say. Then I felt really badly. Then time passed and I didn't know anyone who, I learned that the reason that people didn't reach out was not because they didn't care about me, but it was that they truly didn't know how. It was scary for them. So on the plane ride home, I was like, that's goofy, really. I mean, I spent 10 years not hearing from people, but 100 and something people spent that same time genuinely feeling bad. So where there was an opportunity for connection, instead it was a very lonely time. So then I started just reading and learning more about the bereavement space from a clinical perspective. And of course, learned that nothing about my experience was unique. Bereavement is a very lonely time. When we're grieving, we're at increased risk for pretty much everything. Anxiety, depression, substance misuse, sleep issues, suicidal ideation and behaviors, heart attacks, hospital visits, job loss, divorce, it's this very, very vulnerable time, but yet we don't know how to support each other when it happens. And also, it happens to us all. It's not unusual. right? It's not like preparing for some unlikely event. It's a thing that happens to us all. So that's when yeah, on the plane kind of mapped out. I'd already spent 20 years doing web and mobile applications for other things at that time, suicide prevention, youth voter registration, things like that. And I just thought, what would be the simplest way to get grief support to people and also tips and suggestions to their friends and family who do want to help but don't know how. So that led to Help Text, and that's what we now do in our 50 states and 44 countries. It's
Oh,
pretty cool.
it's not only it's a simple delivery message by
Very
text
much, yeah.
message, but it's perfect. And that's what's so genius about it because honestly, a lot of people in the midst of their grief don't really want a phone call where, oh, I have to answer and talk to someone right now. I don't feel like it right now. I don't want that. And I
Yeah.
think emails, we all know, can go missing and, get lost in your inbox.
Mhm.
But a text message, it's brief, it's to the point, and it's there for you whenever you're ready to read it.
Hmm. Yeah, I chose the right vehicle. And at the beginning, everyone was, "Oh, okay, so you're doing an app." And it's like, well, I've done lots of app development. I actually don't think that's what it needs to be because my experience of grieving is you're not downloading things. You can't even, I couldn't read at all when Barry died. I mean, really, the original text thought was like, oh, that's about as much as I can read, like two sentences before I get lost. So originally it was what's the simplest and easiest. But since launching in 2018, I've now had a chance to talk to like neuroscientists and learn more about the actual dopamine effects of text messaging. So, unlike when you see your email inbox filling up or alerts piling in on your apps, when you get a text, you actually have a little lift, which makes you
Mm.
more motivated and more open to what the message is going to say. So, even if the messages were, gobbledygook, they would already make you feel a bit better. Hey, someone's thinking of me, and I've got a little lift now. And of course, we're not sending gobbledygook, we're sending evidence based grief support rooted in current theoretical models of bereavement, personalized based on your person and cause of death and relationship. So, one, you get your little dopamine lift. Two, you're getting expert information. And that's the magic of it. So I think you're right about text. The text is an important part of why it works the way it does.
Yeah. And I signed up um, for help text before our last interview to
Hmm.
try it out and see what it was like. But it was around the time of the anniversary of my mother's death. And
Mm.
her death wasn't recent. It was, several years in the past. But I was amazed that it allowed for that. It allowed me to enter the date of when she died. And
Hmm.
so every text message that came was appropriate. I mean, every text message recognize the fact that I'm still in my process of grieving for someone
Hmm.
who died a number of years ago. The
Hmm.
anniversary is still important. And that's what blew me away is how
Thank you.
personalized every single message was to my own situation. And I literally felt like someone knows me. Someone knows exactly where I'm at and what I'm dealing with.
Oh,
And
thanks
these
for sharing.
messages are landing just just right. And that's what I think is really phenomenal about how you've set it up.
Thank you. Yeah, well, we work very, very hard on each and every message. Of course, now people are saying, oh, is it Gen AI? I'm like, no. It's really deeply expert, carefully vetted, thoughtful messages based on, like you said, lots of things. Relationship, it's your mom. Time since death, it's been some years. So then we work with people like Hope Edelman on long ago losses or meaning making over time, or, there's not a shortage of wisdom in the world when it comes to grief and loss. There are lots of people with deep, deep expertise to share. So, what we're now very good at is sending the right bits at the right time to the right people, which hopefully is the experience that you had.
Yeah, and the timing, as you say, the right time in terms of chronology, the right dates,
Hmm.
recognizing anniversaries, holidays, those sorts of things.
Hmm.
But also the frequency seems to be just right. to me. And I'm not sure how you figured that out, if the messages are more frequent for someone who has had a recent loss or.
Yeah, they're more frequent at the beginning. There's extra texts around holidays and anniversaries. Now that we also support caregivers when their person is actively dying, we move to a daily cadence. But generally, we're delivering at least 2 texts a week for a full year. I was determined that we would do a full year to bring people through anniversary dates, but I also wanted to keep it really cheap. So the original thought was, what's the most that we could do for less than the price of an hour's therapy? Like, wouldn't it be cool if you could get a full year of expert support for less than it would cost you to get 1 hour of therapy at the beginning? So then we just looked at delivery costs, and we can send about 140 messages in a year. So then that comes down to twice a week plus the extra holidays and so on. And we did experiment with different timing, but generally people seem to be happy with that. It's not meant to be constant. People are not asking for a back and forth or a therapeutic. They don't even necessarily want to talk about it. They're just, thank you for remembering my mom's birthday. Thank you for sending that today. I'm going to try that. Oh, that helps me. That's a book I'll check out. I mean, it's more like just, we're with you. You might feel alone and hopeless, but we are with you, and we're going to stay with you, and we're going to hand pick things for you that we are pretty sure will be helpful and healing. So when we first started, we have a subscriber support portal, and feedback comes in, and people are like thumbs up and hearts and so on. And so this is 2021, I think. I thought we have got to do some research on what's happening here, because anecdotally to me, and as I said, spent 20 years doing web and mobile in all kinds of other areas, and I was like, this engagement rate is through the roof. I've never seen anything like it. And this is people in deep pain. Like over 70% of our subscribers come in the first few months after a death. So, and then others come at 2 years, 5 years, 10 years, 20 years. I lost my mom when I was a teenager. But people often are coming in the early days. So it's interesting, I think, that people in that kind of a hopeless, scary place are engaging with us the way that we are. Our research that we originally had published in the Omega Journal of Death and Dying, we've now duplicated across lots of studies that were published in Death Studies this year. 95% of our subscribers give us a 4 out of 5 or a 5 out of 5 when we ask 2 different questions. One, are these texts helping with your grief? And 2, do you feel more supported? So trying to get to the social determinant of health around isolation, because grief is such a lonely and therefore high risk time. And if you think about that, like, that's incredible. I mean, it's hard to get people to come to a third support group. So for people to spend a whole year and to give a 4 to 5 or a 5, 95% of people, and this is thousands and thousands of people, it really shows that text it works. It's very, very simple, but it works for people. The cadence is enough. People are not saying, oh, please text me every day, or they're happy to be remembered and accompanied for a longer time with small digestible pieces of wisdom along the way.
Hmm. It is so powerful. And when I look back and remember during my times of the deepest grief, and you talked about the loneliness of grief, I didn't necessarily feel the loneliness during the day because I was busy. I had kids, I had a
Mm,
job, but it was in the middle of the night. I'd wake up in the middle of the night and couldn't sleep. And there's no one to call, there's no one to talk to. And just thinking about having a whole series of text messages on my phone, I could go in and read some of those messages in the middle of the night
yeah,
on my phone and not feel so alone, and know that this this happens
yeah,
to other people, and there are wise people who
right.
can
And
share.
you will come through it. There's
Yes.
hope, and you will.
Yes.
There was one girl who's like, she was 17 when her mom died, and she sent us a note saying, I wait until after third period, and that's when I let myself read back, and I've never deleted any of these messages, and this is how I think about my mom. And we have, usually it's guys. So men are about 20% of our global subscriber base. They're less likely to sign up, although that's still twice as many as a few years ago. So 20% is pretty good. So they're less likely to sign up, but when they do, they're even higher than that 95%. Like they love it. So they're the ones that will text into subscriber support. Oh my goodness, I accidentally deleted my text. Can you please send me every single one? Because these are the things that help me since my
Wow.
wife has died.
Wow.
So it becomes, you're right, like a little archive of handpicked wisdom, and you don't have to talk about it. Read them when you, in the middle of the night if you want,
Yeah.
when you want to. I thought that some of it's just the normalizing of the experience. So when Barry died, when my husband died, I mean, it was my first close death. It was a suicide. It was I was upside down, around, sideways, couldn't tie my shoes. Like, couldn't tie my shoes. And there's nothing unique or unusual about that, I now know. But at the time, you think you're going crazy. You're so desperate. There's so much guilt and anger and fear, and you don't know what's happening to your mind. I mean, I was like running a company before that, and then I couldn't tie my shoes. Like, it's scary,
Yeah. It's
like
so true.
terrifying. So, which also makes it isolating. And then on top of that, no one knows what to say to you, so they just stay away. So, it's like the normalizing, I think, as well, is a part of it. Some of the texts we send are not rocket science. They're just beautifully phrased reminders from people with deep clinical expertise talking about, like Mary Frances O'Connor's book, The Grief Brain. We've got 8 texts from the grief brain that just talk about the impact on your brain, and people just feel relieved because it normalizes their experience. Like, oh, yeah, I can't tie my shoes, but I will be able to tie my shoes again because right now this is what's happening,
Yes.
you know?
Oh, yes. I love the idea of that normalization because that takes you out of the place of adding anxiety on top of what you're already dealing with and fear that you're losing your mind and
Yeah.
you'll
I
never feel
really,
okay again.
I really thought, like, now I look back and it's such a waste of brain space, because I think that I mean, I was deeply sad and deeply grieving my husband's death, but I really think that I spent at least as much time again on top of that berating myself for not doing better. Because I was like, oh, it's been a few months, you should be there. I was like, I couldn't. I was upset with myself the whole way through for years and years. Like, the anniversaries would come, and I would think, this is weird. I didn't used to be particularly an anniversary person, but I'm really struggling. So I think I had like the grief, but then I also had the lack of knowledge about grief that made me hard on myself. And turns out that's not at all unusual too, either,
Yes.
common.
Yes. Yeah. How much harder we make things on
Mm,
ourselves and punish ourselves
hmm.
and when we could take that away, the whole
Yeah,
process
just take it away. Just take it
becomes
away. And so that's what
easier
we
and
try to do from the
yeah.
beginning, like right from the beginning. And we probably talked about this last time, but every help text subscription includes a full year of support for the grieving person. But they also have the opportunity, if they want, to add in their best friend, mom, husband, neighbor, colleague. And we will also text those people once a week for the year with their permission, tips and suggestions for how to support their grieving loved one. So, and that comes back to my exact experience, right? So support me, but if you could also just help my sister and my best friend know a little bit about how to help me, or remember that next week is Barry's birthday, or and it makes a huge difference.
Because yeah,
Huge difference.
the interesting thing is as you've learned later, those people in your world, in your orbit are suffering too, and they
Hmm.
really want to help but have no
That's right.
idea how.
Yeah.
And when you think of what moral distress that causes them, they wish they could help, they want to do
Yeah.
something, but they don't want to do the wrong thing. And just those reminders of,
Yeah.
you could call your friend today, or you could what if you sent a
Yeah.
note, or what if you did this, or what if you did that? Like, oh, the not only giving you the idea and inspiration to do something, but
Yeah.
the reassurance that this wouldn't be a bad thing to do. This would
When
be
we, yeah.
appropriate.
When we talk to the subscriber, so we had a subscriber, as a good example, named Sarah. She was in her 20s when her dad died. And She found us on Instagram, signed up for texts, starts getting texts. And then she adds her boyfriend in as one of the supporters, and he now starts getting texts. And she said to me years later, because she posted something on Instagram, and so I met her, she said, I don't know what you texted him. I never asked, but I do know that he made a reservation at my dad's favorite restaurant on his birthday and that asked me to share my favorite stories about him. And it made their relationship stronger. They're now married. But at the time, I said, would you mind if I reached out to Krish? I'd be curious what his experience is, but I'm happy that this helped you. And she said, sure. And he, like so many of our supporters, it turns out, are primarily relieved. But they're just like, I don't know what to do. Thanks for telling me. She's crying. I love her. She's crying all the time. Ah. So they're just relieved to get little nudges and reminders. Here's a way that you could say that. Ask for a favorite story about when they went snowboarding, just basic grief literacy coaching. And I have yet to meet anybody who would rather have, $150 an hour therapy appointment than their own boyfriend asking about their dad. Like, we would rather have a little support from the people around us. And those people, I think, are good and well-meaning. And most of us are lucky enough to have people who do care. We're just frozen. We
Yeah.
just don't know how. We don't know how.
And it's interesting because I've even felt that reluctance sometimes with people I know who are grieving, you know, is this the right time? Should I say something today? What should I do? I mean, even those of us who are comfortable with death and dying and talk about grief all the
Hmm.
time, there's still a little obstacle there to
Oh,
reaching out
definitely.
because we aren't sure if it's the right thing. And I think those reminders and suggestions would make all the difference.
Yeah. I had a hard time this morning writing a text for a woman whose son died on this day some years ago, and I wanted to make sure I remembered it, but it still takes some time to craft it the way you want. It's not easy, and that's what help text does. So we're going
Yeah.
to text you, but we're going to text the people around you as well. They have to say yes, they have to opt in and everything. But it's just a nice thing that happens. Like, another one of my favorite stories is, you'll enjoy this one because it's a nice hospice story. So we had a bereavement coordinator at a hospice in Ohio. So her hospice is offering text support to their hospice families. And a 68-year-old woman who had been widowed signed up for texts. So she's receiving texts, but she adds in her 38-year-old son as one of her supporters. And according to the hospice team, they were like, this guy would never have come in for a group session or signed up for any of our bereavement programs, but he's okay to get one text a week with a suggestion for how to help his mom, right?
Mm.
So now he starts getting a weekly text, gentle nudges, suggestions, not for his grief so much, but for how to help his mom. And then he got a message apparently about making his dad's favorite foods. So on this Sunday, he went over with ingredients and was going to hang out with his mom and make her favorite, his dad's favorite food. And then this turned into a weekly thing. And then the 13-year-old daughter was like, oh, this actually seems kind of fun. Now it's not visiting my grieving grandma. It's, hey, let's think of food that he liked making and we'll go and cook it and have fun together. And so that is a transformative thing for the widow. And it's a lesson for the son that he then takes forward in other ways. He just learned that there is something that he can do to just accompany someone who's grieving, and now the daughter, right? And I can't think of anything that the widow would want more than for the son and granddaughter to come over on Sundays and hang out.
Yeah. Oh,
So it's
wow.
like simple in a way, but it's not. It's profound. That's a profound difference in a grief journey.
And meanwhile, the son, who, like you said, would not have signed up for any kind of bereavement support for himself, was actually receiving it through
Yes.
the things he was doing to help his
Yeah, by
mom.
suggesting how to be caring for her. I know, I love that
Yeah.
so much. Like, there was
Wow.
another one where a woman's her baby was stillborn, and her best friend had flown out to help her. And the day after, the best friend said to the new mom, "I just don't know how to be with you when you're like this," and left, flew home.
Oh,
And so
yeah.
now you come back home, you've got your nursery set up, your baby has died, your husband's drinking too much and your best friend has disappeared because she doesn't know how to be with you. I
Wow.
mean, like, you want to talk the isolation of grief, like that's pretty much up there. So she signs up for texts. She starts getting texts about stillbirth and she adds in this best friend. And like 2 days later, the best friend texts us, writes back to help texts and says, "Thank you for understanding. This is hard for me too. I don't know what to do." Because we had to give her some compassion. We can't just be like, it's hard. It's Most people have not sat with someone whose baby was just stillborn. It's not an easy thing to do. So we're offering her some compassion first, saying, "This is a really hard thing. We're here to help you be there for Michelle this year. We're here to help you. Here's a 1 minute video with some suggestions. Here's just actually coach her and what to do." And so again, it's a small thing, but it's not, because that would have been a fractured relationship forever. That's difficult to come back from something like that. So
Yes.
instead, the friend leaned in, got some support, learned how to help her friend, and then that relationship is cemented forever,
Wow.
you know.
Wow. It's just the ripple effect of that is
I love the
incredible
ripple.
because every support person who gets text to help them support someone else in their grief has become so much more grief literate for themselves and their
For
own lives and
themselves.
whatever loss they experience in the
Yeah, the
future.
ripple effect is super cool. We had a dad, like last year, I guess it was. So his daughter's wife had died, and he said, so he was getting texts for how to support his daughter. Um, and I think he had always struggled with that relationship when the wife was alive, and he was an older guy. And he texted us back in midstream through the subscription. He's like, "I have a better relationship with my daughter now than I ever have." Because he's getting, like you said, it's these are little tips and nuggets that you can take forward in lots of different ways. We work with really cool neuroscientist guy, Galen Buckwalter is his name, and he says that grief is a window into change.
Mm.
So it's a bit like when you're pregnant, you think about what you're eating in a different way, right? Healthy food when pregnant. When you're grieving, you actually are open to change. Your brain becomes elastic because it's so far off the charts from your normal experience that you actually are quite open-minded. And so, yeah, this dad thinks differently about his daughter's relationship and then has the best relationship with her that he ever has. And the friend after the stillbirth is open to it because it's an extraordinary moment, and it lets us actually be open to change, which is, I think, the even bigger, interesting ripple effect idea.
Yeah, and because change takes time and takes place over time, that makes it really important that the messages keep coming for a year because the support's
Agree.
ongoing, the wisdom is there. Some people might not be ready for it at the beginning and, may not be able to take it all in. But after a year's time, it seems like a lot of people might be ready to even go back and reread some of the things they couldn't read before. And
Yeah,
it,
everyone's timeline is different for sure. When I was on that airplane ride, I naively mapped out a service that would provide support when someone died. And now I'm like, no, it can be many years later. People come to it when they're ready. So we had a guy last week in the UK who started to sign up, but he didn't finish the sign up. And so my subscriber support person emailed him like, "Do you need help? We can help you finish the sign up. So sad to see that your wife has died." And he just wrote back and he's like, "I just can't even write her name down
oh,
yet, yet."
yeah.
So that's going
Wow.
to be his timeline, and we'll come back to him when he's ready. But right now, he can't even utter it.
Wow. Wow. Um, I was curious to know if um most people sign themselves up for the text, or do people sign a loved one up, sign someone else up as a gift, or I don't know
Mostly
what the
people sign
statistic
themselves up.
is. Like,
Mostly people get a subscription from their hospice, their tissue bank if their loved one was an organ donor or a tissue donor, from their friends and family who buy it as a sympathy gift, but they're still doing the sign up. Yeah, mostly people do their own, mostly people sign themselves up when they're ready. We do sell sympathy gifts. I mean, it's, you know, less than a bouquet of flowers to give someone a full year of expert support. So I think it's a lovely sympathy gift. We have some guys who, we have one guy, Mark, who originally was received a gift subscription when his dad died. And in his telling, he was like, this is a really goofy idea. Like, text messages are not going to make me feel better. My dad has died. But about 3 months after his dad has died, he's like, well, my friend already paid for it and I am feeling lousy, so I guess I'll sign up. And he found them totally game changing. And he's now our number one gift buyer. So he buys gift subscriptions
Wow.
always for guys, and finds them to be just a really awesome sympathy gift because he's like, I don't know, I send flowers to my guy friends. I don't know. A week later, they were hitting the compost. I don't know that it's helpful. He's like, this feels helpful. They'll sign up when they're ready, but it's there for them. And I can tell them
Wow.
honestly how much it helped me. So I love that when it
And,
does happen. But usually it's people signing themselves up.
and that's perfect because when I think about some of our traditional ways of supporting people who are grieving, it does seem like they may be more oriented to women who are grieving and kind of leave men out of the picture. And so it makes sense that this this is a really viable way of offering a man support in his grief that feels appropriate to him.
I think it's great for guys. I mean, we haven't done a separate study on this yet, so I can only say what we see anecdotally. But as I said, like they're about 20% of the global subscriber base, but their acceptability is over 95%. So it's probably because they're less likely to be doing other things.
Mhm.
They're less likely to be in group. They might even be less likely to be talking to their friends about it. It's super discreet. Just read it when you want to. You don't have to worry about your voice cracking. You don't have to actually talk about it at all. You're just getting some text and you look at them when you want. We have all kinds of stories of like people that I even know on a business sense that will just try the text out to evaluate the service and then are shocked after a few weeks. They're like, yeah, these messages are really helping me because it's just men are just less likely to be getting that stuff. So it's super low threshold. Don't have to talk about it. Handpicked for you. Read it when you have a minute.
And you mentioned hospices signing up their family members for the help text of families of patients who've died in hospice,
Hmm.
which I think is brilliant because the hospices I've interacted with, in the last probably 10 years have all told me the same thing. They are strapped. They don't have enough staff to provide the bereavement services they would
Hmm.
like to. They know what they've been offering isn't adequate to really
Hmm.
reach out and help people, like sending them a form letter every month. And
Hmm.
to sign up their families for help texts, that seems like a phenomenal service that a hospice can offer that is literally going to change lives and genuinely help people.
When we work with hospices, it really is incredible. The hospice family, we actually have a whole research study that was just from 5 US hospices. So the hospice families absolutely love it. And of course, 150, 140 personalized touch points is going to land more than a form letter at month one, month three, and month six. So the touch points and the caliber of the support is of a different level. But sometimes the hospice teams resist the idea because their bereavement, this can't work, it's text, and so on. So the interesting thing is, yes, it works really well for families, but also it's the hospice teams themselves that end up loving it the most because it's a relief. Like, oh, now I'm not the only person that's going to care for this. I've just spent 3 weeks caring for this man and spending time with his wife, and I don't just walk her out of the building with nothing and take that home with me that I'm now trying to hold her grief and realizing that she doesn't have support. So usually the hospice teams, even if they're a bit skeptical at the beginning, once they see the feedback coming in, once they realize that, oh, now we actually get to support the son and the granddaughter, it actually just makes the whole system work better and it's a
Oh,
relief.
Yeah, absolutely. I think it's perfect. I think it's a win-win. And as we talking about moral distress, the
Hmm.
hospice staff providers who can't give the type of care they would like to and the
Hmm.
follow-up, and to know that there's still touch points for those family members that they cared for.
Hmm.
Yeah, I think
And
that's an enormous relief for them.
in 2022, so after you and I spoke last time, we actually launched a whole second service for um, healthcare workers. So, because we were working with hospices and their teams were experiencing burnout and fatigue and they were having a lot of attrition, they asked if we could do something similar to help text, but specifically for healthcare workers. And at the time, we were like, could we? But in 2022, we launched a full year of support. It's occupation aware. I think there's like 30 different healthcare roles from chaplain to hospice nurse to ICU to first responder, medical examiner, nurse, so on. And then we text messages around moral distress, burnout, fatigue, but we also send scripts. Here's what you might say to this family member when their child dies. Here's how you might care for yourself when that patient dies. So yeah, we have a really interesting stuff, and also tailors based on the workplace setting. So, and the types of deaths you're seeing. Are you seeing more sudden deaths in an ER or older adults in hospice, or you're in a NICU and work with people like Wei Wen Sato, who does amazing work around nurses and their experience of bereavement, in her case in a NICU, to do the same model, right? It's the wisdom exists. So who are some people with beautiful expertise to share? And can we just text it to those overwhelmed, stressed, exhausted people who need to hear it?
And the model is perfect for that group of people because I've thought of this over and over again. I think grief is a significant issue for healthcare providers who never get a chance to deal
I
with
agree.
grief over the death of a patient. And yet, how do we help them? What do
I
we do?
agree.
Hold
Yeah, it's a real
workshops?
gap.
They don't have time to come. They won't read a book. They don't have time for all the things we could think of to offer them to be helpful to them. But a text message, yes, yes, they have a few seconds to read that when they sit down to eat their lunch, or
Mm.
at various times during the day. And so, oh, it inspires me. I feel so excited about it because of the potential to really make a difference.
Thank you. Me too.
Is that something? I mean, I have this dream, like how would we get healthcare providers to sign up for it? Or is it something, do you have like a hospital that would purchase it for their staff, or for a staff member who had experienced, a difficult loss or trauma?
Yeah, so that's the model mostly, is that healthcare providers are looking for ways to provide support their teams, and then they purchase packages and offer them to. I mean, help text is very cheap, and there's nothing to install and nothing to integrate. So there's no tech setup. I mean, it takes 4 minutes to sign up. You get your first text right away. No wait list. You stop and start whenever you want to stop and start by texting stop and start. So it's very simple, low threshold for organizations as well as for people. So yeah, we've started trying to work with healthcare providers. We also now work with some universities that are providing support to their grieving college students on campus, for example, because the same thing, the university counseling office has maybe two counselors. The wait list is endless. They might not have any grief and loss training anyway. So just a way to offer more to people who need it. There's just so much need. People are having a hard time in lots of ways. I say to my team, like, we're so lucky because every day feedback pours into our subscriber support, and it's people just grateful to be accompanied, to feel a bit more hope or to feel a bit less desperate. There's just so much need.
Yeah.
And wait lists are frustrating. Like we talk to organizations that provide support after the, violent death of a child, and you have to wait 6 months to get a first appointment. I mean, it's just not good enough when
Yeah.
you think about how much risk and how much pain that parent is in.
Yeah. And you mentioned the help text for caregivers, which is also new since we spoke the last time too. And I'm also very interested in that because that's another group
Uh,
that is so often underserved and undersupported in general
yeah.
in the work they're
Well,
doing.
so because we were working with hospices, then I was talking with one of our hospice CEOs in Ohio, Master John, and he was like, "Well, it'd be better if we could offer support from intake instead of waiting till the patient dies." And often hospice patients are only in hospice for a few weeks. So originally we thought, well, could we significantly expand the platform in order to comfortably do the same thing for caregivers from intake so they know that their person has a terminal diagnosis, they know they're dying. What do they have that's speaking to the anticipatory grief, to caregiver stress, suggestions for caring for that patient and for yourself in this most tender time of your life. So that was a big lift, but we worked again with lots of experts. We worked with Barbara Carnes, Queen of Hospice, took
Mhm.
her little blue book that she sold 30 million copies of, pulled it into little texts, send them straight to the wife who's bedside with a husband who's in the last weeks of his life dying of Alzheimer's, let's say. So it's so kind of back to the original thing, text just works. It's just kind of easy. If you're bedside with your husband who's dying, you're not going to actually go to a bookstore, buy a whole book, textbook on grief and read it. You can't, that's just not what you're going to do.
Yeah.
But you'll take a couple of texts. Barbara says it's like having Barbara in your pocket.
Yeah.
Like, you'll take a couple texts from someone who has been bedside with thousands of people, and we say to our experts, if you could say four things to this person, what would they be? What are the gems that you've heard yourself say so many times bedside? When someone's actively dying, we move to a daily cadence of texts. So we'll talk about like the changes in breathing. We talk about, you've spent all this time providing sustenance through food, but now his body doesn't want food. So you're going to try sustaining him in this other way instead, touch and voice and so on. So that's tough stuff.
Yeah.
But when I was bedside with a friend who was dying, no one told me any of it. And that's the usual experience. So it feels scary because it is scary. It feels lonely because it is lonely. And no one's telling you what to expect or what you can do to have any feeling that you're doing the right thing.
Yeah. And even if the hospice nurse tells you something when they're visiting, gives you some advice or tells you something in the middle of the night, you can't remember exactly what was said to you. I mean, literally,
Mm-hmm.
it's just so hard to remember with so many things happening. Like, what did they say to look for? What was I supposed to
Mm-hmm.
do again? And so having that text message and knowing where it is and you can access it and go back to it
Mm-hmm.
is so valuable.
Yeah, yeah, I really love our caregiver product and our healthcare worker product. I mean, we don't have the same depth of experience with those as we do with the grief work, just because they're much newer. But some of the messages that truly make me tear up are surprisingly things like script for nurse when patient dies. Like
Mhm.
it, it's so beautiful and actually so simple. And once you've locked it into your brain, you have something nice that meaningful that you can say. Um, yeah. So I actually think that I mean, it's all grief informed. It all comes from the years that we'd spent doing grief support before that, but it's still kind of weaving that in different ways, a little bit upstream for the caregiver when they find out the person is dying. So caregiver support, we originally began with 6 months to live, sort of trying to, again, because we're working with hospices and trying to focus on that really tender time, but now we've extended it up to a few years.
Mm.
So lots of care for people who are themselves at significantly increased risk themselves for stress and depression and loneliness and everything else. It's less, there's so much talk about crisis prevention and crisis intervention at the end, but I'm like, just go upstream. We know when people are going to be at risk. Bereavement shares a powerful intersectionality with pretty much everything. Just here are times when we are likely to need more support and have these negative health outcomes and therefore cost the system money.
Mm,
So let's just help people there before they're in crisis. It works really well.
yeah.
People can help
Yeah.
themselves. And if their friends and family are getting suggestions for how to help them, then all the better.
Wow. I have to say, really, truly, this blows me away. How powerful it is, what an impact it's making. And I'm so impressed. I'm so impressed with
Thanks. Well, it
your,
coming from you, that means a lot because you know this space upside down and around and intimately. So I love that you understand the need.
but it's just that it's so genius and so simple at the same time. And you listened to your own inspiration and to intuition, and you made this happen. And it's really wonderful and such an asset. And I wanted you back again to just to keep reminding people, like, make
Thank
sure you're telling everyone. If you're a death doula, you should tell everyone about help texts, everyone you work with, because either they need it right now or they're going to. And whatever, if you work in hospice, tell your organization about it. Or if I think funeral homes, probably they're using them as well, I would guess. And financial planners who do estate planning with people. And I've been reading a lot of articles by financial planners talking about how much grief they witness and they don't know
you.
what to do about it. It seems like
Oh, yeah.
another good group that should know about help texts because
We're so for people like that, because sometimes it's even like customer service teams that work in organizations where the people are, their pet has died, let's say. The customer service team are not grief counselors, but yet they spend all day talking to people who are grieving. And financial services, you're right, it's the same thing. You've got now a primary caregiver who's trying to either the person is going to die or has died, and they're financial planners. They're not
yeah,
bereavement counselors.
exactly.
So I think, and same way that knowing that the client is getting grief support relieves stress for the hospice teams, it also would for the financial plans. Like it's just a relief to say, hey, you know, my firm's really pleased to provide this full year of support for you. It's a gift from our organization, and I hope it can be helpful.
Yeah, yeah.
And then they're getting grief support at the same time that you're trying to help them do their documents and
And in
wills
lieu
and
of
stuff.
sending flowers, uh,
For sure.
give something that will really make a
For
difference.
sure. And it's a full year. So where the flowers last a week, when the person's brain is able to think a little bit more, when the fog lifts 6 months later, they're still hearing from you. You're still remembering the husband's birthday. You're right. It's that longitudinal care is really meaningful because the first couple of weeks are a blur. You barely remember. You're not going to remember who sent which flowers or anything about it.
Yeah,
Um, but you do notice the people who stick with you 3 months later when people have all gone back to work and their normal lives.
yeah, so true. Well, before we run out of time, I wanted to make sure that you mentioned some of the newest offerings that you have from
Oh,
Help Text also, which there's even more than what we've already discussed that you're doing now.
yeah. So we began with just grief, then we launched for healthcare workers and then caregivers, caregivers specifically caring for someone with a terminal diagnosis. But then we launched pet loss in July of last year, which it's fascinating. This is a learning curve for me, but pet loss is such a disenfranchised loss. If your dog dies, you're not going to go to a hospice bereavement group. It's in some ways even harder to get grief support when you're grieving the loss of your pet than it is if you're grieving the loss of a loved one. So we worked with like palliative veterinarians,
Mm,
really interesting people who again have deep expertise in this area. So then craft text, customize it based on the kind of pet and the cause of death. So we had to add texts for euthanasia and euthanasia due to bad behavior, for example. That stuff is tough and no one talks about it. So I always say to my team, like, the harder it is, the better we are at it. So we launched pet loss in July, and then in September we launched a separate. We've always had support for stillbirth, but we had been wanting to launch a separate service for pregnancy loss,
Mm.
which was quite complicated to launch technically because of the way the dates work, due dates, and so on. But in September last year, we launched Help Text for Pregnancy Loss, which is beautiful support that's very much tailored. We worked with even people who focus on the experience of dads after a pregnancy loss. So we're texting more nuanced messages to them and then to mums, but also grandparents and so on.
Mm.
And then this year, earlier this year, we launched Help Text for Health and Wellbeing, which in a way is what people have been asking for from the beginning, because from the beginning, people were, oh, do you have support for divorce or depression or all these other things? So now we have Help Text for Health and Wellbeing, which is what it sounds like, a full year of messages with tips and suggestions for health and well-being overall. But because we're good at the tough stuff, there's also a long list of things that you can discreetly weave in. So depression, anxiety, divorce, bullying, financial stress, loneliness, thoughts of suicide. So now we're texting people who share with us that they're having thoughts of suicide at the same time that they're getting health and well-being support. Um, yeah, all kinds of other
Wow.
things. So that one's the newest one, and it's been interesting. We're working with some seniors organizations who are really wanting to support seniors in self-management and their health and well-being overall. So we have also then messages specifically tailored for seniors around health and well-being overall. So yeah, that's the
Wow.
newest one.
It's incredible. Mm.
I don't,
It's
I work a lot.
I mean,
Not
there
many days off, but yeah, we're getting a lot done.
oh, so much. It's amazing. And and yet I could still think of
And
quite a
there's
few
still
other
more.
there's so much more. So
I know.
it's really amazing. But I'm just so glad that you were able to come back and share all of this wonderful information about what you're
Really appreciate
offering
it.
and to remind people you if you to just go to the website, right?
Yep, just sign
Helptext.com.
up, helptext.com. It literally takes it's a single form. We'll just ask you first, share the name of the person who's died, Jonathan. If you're comfortable sharing how he died, what was your relationship to Jonathan? It takes 4 minutes. Your first text will come to you in like right away, and that's it. Then we'll just keep texting you until you tell us to stop.
And I noticed there's a tab for organizations. So if the hospice or a business that wanted to get a
Hospices,
package or
employers that are looking for a bereavement benefit for their employees. I mean, we're such an easy way to text not only the bereaved employee who's coming back to work, but we also have tips for managers, colleagues, how to support your employee when she comes back to work after her husband dies, because the managers don't know.
yeah,
So yeah,
exactly.
employers, hospices, we work a lot with tissue banks and organ procurement organizations, universities, funeral providers, charities. So people, cancer support agencies, things like that.
And so the
And
contact information is right on the website. It's easy for anyone to get a hold of you to set something up. And again, like you said, it's the simplest,
it's really
it's
simple.
the
Nothing to
simplest
install,
service to
no
offer.
no
Yeah.
integration. From the time that organizations write to us, 2 weeks later they can be live. We do a short training with their team to just help them get up and running. But yeah, it's very, very simple
Yeah.
and cheap.
Yeah. Oh, yeah. It's a it's really amazing. I'm so impressed with what you've done and how you've grown.
Thank
I
you.
can't wait to see what you end up adding on next
Well, we're not launching anything else. No new products for at least the next few months. We're
for a while.
just trying to
Okay.
figure out what how to
Well,
do best
but
we can with the ones we have. But
I'm
you never
sure
know. Never say never. Things change
exactly. Yeah.
quickly.
I'm sure if we talk in a couple years, I'll be blown away again by what
Yeah.
else you've done. But
Yeah.
well, I'm just so excited to let all of my audience know about help texts, and I hope everyone will check it out because it's definitely making a big difference. So thanks so much, Emma, for talking with me.
Thanks for having me.
I hope you enjoyed my conversation with Emma Payne and that you'll check out help texts. If it's not something you're already familiar with, go to helptexts.com and find out how helpful it can be for the people that you're working with. And it's something you should be recommending to everyone, I believe. So I'll be back next time with another interview with you for you. And until then, take care. Bye bye.